What's up, everybody? Welcome to the Couple Nurses podcast with your hosts, Matt Shutrick and myself, Peter Findera. This is a podcast with current health news and hot nurse topics, one conversation at a time. Firstly, I want to thank you guys for tuning in, for listening, whoever's out there in live stream. Thank you for waking up this early in the morning for us. I know some of you California folks might be a little early, but we do appreciate it. And make sure you guys follow us on YouTube. Give us the good ratings on YouTube, Spotify, Out Podcast. Give us that love. And also don't forget to donate to the Fight for the Forgotten. Matt and I are doing the 4x4 by 48 challenge, and all proceeds and all your guys' donations will go to the picnic people in Africa. So thank you for that. How's it going, Matt?
Beautiful entropy, like always. In this episode, we'd like to introduce Chrissy Massaro. She is a CRNA that helps young professionals thrive in healthcare. She's a medical professional that helps to improve workplace culture, build resilience, and advocate for safe nurse-to-patient ratio. Chrissy, how you doing?
Hey, good. How are you guys? Thanks so much for having me.
We're great. Loving this weather in California while it's snowing everywhere else, it seems like, so no complaints at all whatsoever.
You're rubbing it in.
Can you tell us a little about yourself?
Yeah, so I'm a nurse anesthetist. For those of you who are not familiar with that term, that means I give anesthesia in the operating room. I've been a practicing CRNA for a little over 3.5 years now. I work in Philadelphia in a big city hospital. Before that, I was a cardiovascular ICU nurse. So I worked with patients who just had heart surgery. And nursing was actually my second degree. My first degree was in psychology. So it was kind of a convoluted path to get here, but I love it. I love what I do. And I'm happy to, be growing a social media presence to kind of spread the word and try to just make healthcare a better place for everyone.
And did you start in the CVICU, like straight from nursing school?
Yeah, I did. It was funny. When I graduated, there were like no nursing jobs anywhere. And I applied to jobs in 3 or 4 different states, including rural areas, any type of floor I could get on. It didn't matter if there's a posting, I just applied to it. And I got really lucky. I happened to be babysitting for a surgical resident who was rotating through the CVICU at the University of Pennsylvania, which is like a major hospital. And he overheard the manager say they were hiring. He gave her my resume and I lucked out. I got in. So it ended up being, a perfect job for me in a lot of ways. It was challenging in others. Starting as a new grad in the ICU can be really challenging. There's definitely a lot of like a steep learning curve, a lot of, of course, like nurse bullying that goes on there. But once you kind of get to the level where you're comfortable, I feel like you hit your stride. And I really loved working there.
Yeah, everybody makes these memes off like CVICU nurses, and every time you talk to a nurse, like ask where they work, they always say CVICU if they do work in the CVICU. Do you think these memes are true and like the typical CVICU stereotype is legit?
I think it's absolutely true. A lot of the stereotypes, of course, we can't generalize to everyone, but I think anytime you're on a CVICU, at least in any hospital I've ever been in, and a lot of nurse anesthetists used to be CVICU nurses, there's always a percentage of people who, are just like very intense in how they do things, very like type A personalities, and, maybe a little harsh with other people, or maybe think that they're like the toughest or baddest nurses in the hospital and nobody knows as much as them because they run the ECMO machine. Like, nobody knows as much as I do. But of course, most of us are not like that. Most of us realize that, obviously there's value in every type of nursing. You can learn something from every kind of patient population. But there's always a small percentage of people in every unit who are like that. So
yeah. They're just very anal about like eyes and nose and everything, right?
Oh my gosh, eyes and nose. They're just so, you think about, I feel like CVICU and ER are almost like perfect opposites. ER nursing is like what's the sickest patient? What do I have to do right now? And they're just like putting out fires everywhere, right? In the CVICU, you have 2 people and they're critically ill and they're so sick and they're so unstable and they have so many lines and drips and you have to keep it all organized and be super on top of it because, something can change in a split second or, one line out of place, one small thing can kill a patient. So you kind of have to be really, really thorough in particular. And it's just different goals of care, right? So that's kind of like what breeds these personality types or kind of like attracts them, I think, to different types of nursing.
I've been enjoying that side of nursing because I've taken a few ECMO patients as a traveler, even though I'm not certified to take them. It's kind of like the Wild West now, right?
Yeah.
I'm kind of curious. So, did you use your psychology major at all, or did you just go right after to nursing school?
Yeah, I went right after to nursing school. So when my first degree was actually not first degree, my first major. When I first went to college, I initially was a social work major. Um, I was interested in going into medicine, but at the time I thought like the only two jobs in healthcare were doctor or nurse. Like many people just don't really understand. It's such a wide field. And I don't think I really understood or appreciated nursing at the time. And my family really was discouraging me from going to medical school because obviously it's such a long road, it's so much money, yada, yada. So I was like, okay, like how else can I help people? I started out as a social work major. I really loved what I was learning, but I really am a nerd deep down inside, and I really miss like studying science content, which is like so strange, right? For my elective courses, just started taking anatomy and physiology and chemistry, and I was like, well, where can this lead? And my anatomy and physiology teacher was a nurse practitioner. She was amazing. She's brilliant. So I started. And then I switched to a psychology major. That way I could keep my science courses and I could keep my social work courses and just kind of redirect and figure it out. So that led to me taking a internship in Mexico where I got to shadow different doctors and different specialties. And I got really close with my academic advisor who was a big researcher in psychology. And I really started to just pivot more towards the sciences. So by the time I finished, I was working as a nurse's aide in a surgery center, and I discovered what CRNAs were. And I had all this exposure to like amazing people in healthcare. So I was like, you know what, let me go back for a second degree in nursing and see where it leads. So that's kind of what I did.
Yeah, you mentioned bullying a little bit ago. When was like the first time or like a prevalent time that you really noticed how negative nursing culture can be, or how prevalent bullying is in nursing?
Nursing school for sure. I was shocked at how mean the nurses were to nursing students. You know, I think a lot of it was just they were really stretched thin, too many patients with too high acuity, not enough bodies to take care of them. And having a student on top of it was just one more thing that they didn't have time to deal with. So I think there's a lot of like lashing out, passive aggression, a lot of like belittling. You don't know this, you didn't learn this yet, because people are wearing really thin on patients. And they also have a lot of compassion fatigue from just constantly being exposed to stressful situations. So I think that's the first place I picked up on it. And again, when I got to the ICU, you know, so many people there were supportive, but there were definitely people who, you know, fell into the other category, which I feel like when you're a new nurse, you just take it so much more personally and it's so much more hurtful to you. And that's the time when you need the most support. So it's really paradoxical, isn't it?
We talk about all the time that as a new nurse, you have to take that leap of change where you internalize everything, you take things so personally, even if it's your patient crashing, right? And then eventually, maybe a year or two, I think it took me maybe 3 years where you have that off switch, right? And this older nurse gave us like a gem, and she's like, as soon as I clock out of here, I don't think about this place. And that's really important for our own like mental health, right? Because we need to de-stress, clock out, mentally check out, and have other pursuits, just like what we're doing now, right? Because the workplace is stressful. So putting psychology together and everything your major, what did you notice about the workplace culture? And we talked about bullying as one of them, right? What else did you notice that's negative, and how can we improve that negativity?
So I think, again, it really goes down to a lot of people not feeling supported and feeling really stretched thin. And instead of appropriately identifying and verbalizing what's going on and finding good solutions to address it, there's a lot of covering up of those feelings and deflecting and projecting. So if you're feeling insecure about something, maybe you're not happy with the role you chose, or maybe you're not happy with your job. So instead of, you know, addressing different ways to maybe study more and become more confident, or whatever the solution should be, or perhaps going to therapy, right? Instead, we're taking it out on the CNAs, we're taking it out on the residents, the interns, nursing students, right? Other nurses. So a lot of deflection, a lot of just not really addressing the underlying issue, and a huge lack of self-care. People are really, really proud of all the overtime they picked up. They're really proud of, how many shifts in a row they work. They're really proud on doing so much on so little sleep. And that's not really healthy, right? We all need rest, and we all need to be able to sit with our feelings and kind of process them to be well.
Yeah, it's very true because I was one of those like during like the peak of COVID, everyone was picking up overtime shift. People were like, "Yeah, I've worked like 14 out of the last 15 days." Everyone was proud of it, but then they looked like shit. Like they came to work exhausted, super tired. And you mentioned like nurses being stretched thin and not being able to properly teach these new grad nurses, or not being able to support new nurses on the unit. And I think a lot of that has to do with ratios, especially where like in Illinois or a state that doesn't have mandated ratios like California, being stretched thin is 100% due to ratios. Because if you're stretched thin at work because you have very ill patients and you don't have like people to support you, you're not gonna be able to support anybody else. And people get frustrated, they get angry, and they just don't like coming into work. So have you ever dealt with a situation where like your ratios were unfair, but you couldn't really do anything about it?
Yeah, we were really lucky. So I think in the ICU, we have pretty firm ratios, 1 nurse to 2 patients. I know that a lot of hospitals, when they were in COVID surges, nurses would take on 3 ICU patients at once, but I don't think that happened at our hospital. And I obviously don't work in the ICU in that role currently, although I did have to cross train and help with respiratory therapy for a while. But I will say that what happens is your ancillary staff gets really stretched thin. So instead of having adequate CNAs to help you, or you basically have to just deal with it, right? So we would have a CNA call out or get injured or something like that, and then you wouldn't have the help. And if all of the patients are very sick that night, maybe other nurses can't help you either. Normally you try to team up with a buddy and do what you can, but if a patient's crashing down the hall, the doctors are busy, the other senior nurses are busy, you're kind of left out on your own. So I feel like that would happen more often than I would have liked. That unit has made a lot of improvements since then in nurse staffing. They've increased the number of nurses, and they've added a resource nurse because that was an identified problem, which was awesome. And they have added on more nurse practitioners overnight to help as well with like guiding care, because we would often be stretched thin with 2 emergencies at once and no doctor to help. So they've gotten attendings overnight and nurse practitioners overnight, which is a huge change and has increased the patient safety. But I see on our step down units and our med surg floors, nurses definitely, they have mandated hospital ratios, but they're still way bigger than California. In California, what do you guys have? 4 patients to a med surg nurse. In our hospital, it's 6, which is still very luxurious compared to other hospitals my friends work at, where they have 8. Could you imagine 8 patients? People are sick in the hospital today in med surg. If you can walk and talk, you're going home. You're not staying overnight. So these are not 8 healthy people. These are 8 people who really need a lot of care. That's some scary stuff.
Yeah, it's super scary. And like low key, I'm probably more afraid to be floated to like a med surg or a tele unit than I am of like a crashing patient, just because having more than 2 patients, even though they aren't as critical, like it's like a little overwhelming for me, because especially in the ICU, you're very nitty gritty. You devote all your time and attention to those 2 patients, and you're just working in between them, right? And now you're kind of transitioning to like a tele for a med surg floor where you got 4 units, and you still have the same mindset of like an ICU nurse where you want to do everything for these patients. And that's it's not always an option for you to do. But my question for you is, you talked a little bit about being healthy outside of the workplace. How did you manage stress while you were at nurse, and how did you manage stress as a CRNA right now?
So when I was a new nurse, I was really bad at it. It resonated with me what you guys were saying earlier about like how when you're a new nurse, you just internalize everything and you kind of just take it with you around the clock. And it did take me about a year to kind of start to turn that off. I don't think I fully turned it off until later down the road, but now I do keep work very separate from my home life. What's really nice about anesthesia is that you have 1 patient at a time, right? So all those stresses of like 2 critically ill patients at once in the ICU, if the patient in front of me is crashing, I have a ton of resources, I have a ton of support, and I only have to focus on that person. There's no one in another room that I have to think about. So in a way, even though my level of responsibility has increased, I feel that my stress has decreased because I don't feel pulled in multiple directions at once. As for dealing with it at home, though, after a stressful day, I feel very lucky. My husband is a nurse, so he's really supportive and a good person to talk to. But I think having healthy boundaries with work, right? Not taking too much per diem, not taking too much overtime, um, knowing when it's time to take a vacation. I try to take vacations regularly. When I was a nurse, I would like never take vacation time because I would feel guilty about leaving the unit. Now I make sure to take my vacations. So I really think the biggest thing is just boundaries, just learning when to separate work and home and just give yourself a break. And it keeps me sane. I feel so much happier now.
I'm sure having that psychology major, you see everything that's happening in that workplace, right? Like the culture, just like we mentioned. What's one thing that you wish you could change in healthcare when it comes to culture? And I'll mention my first one before I ask you. For me, it would be drama, because especially seeing that day shift, night shift, as travelers, that's what we're seeing like hella right now. Right now, there's a huge divide between day shift and night shift, and we're seeing the cattiness come out. Like, it's funny being a traveler, seeing all that on the unit.
That's so funny to me. Like, I see a lot of jokes and memes around the internet where people talk about that. And on my unit, we were all required to rotate between days and nights. So there were definitely people who prefer days, or who were more senior who were on days, or people who were more senior who were on nights. But the rest of us had to rotate. So there was a little bit of like a difference in the personalities, but because so many of us rotated, I think we understood both sides of it. So we didn't have it that much. But it's so funny that you mentioned that, because I hear that everywhere. For me, I think the biggest thing I would change is competition. I think competition is like the underlying root of so many problems. And I think it starts with how we even get people into school, right? Nursing schools are very competitive these days. Oh, you have to be, have all these grades to get in, and have all these extracurricular activities and do so many different things. Same thing for medical school, PA school. Everyone who gets into healthcare, these are all very competitive degrees and fields to get into. So you already have people who see their coworkers as competition starting from high school. That's a really unhealthy mindset to start out in, right? And then going through school, people trying to one up each other in clinical, right? Or, if I have to get the better score, or I have to have these experiences, and people talking about, I put in an IV today. You haven't done that yet, right? Like, didn't you experience people like that? Yeah. It's so crazy. When really the attitude should be, I got to put in an IV. Can I help you so that you do really well on your IV, right? Like, that should be the attitude, is collaboration. And I saw this so much in grad school and in nursing too. Just, I think there's, when we're competing with each other, we get jealous of each other. And then instead of looking for ways to make each other better, it's a race to the bottom, right? If you're trying to put people down and make them look worse and make them feel worse about themselves, you're weakening the team. Like, the patient's going to ultimately suffer, right? Because if people don't want to come to you to ask questions, they don't feel confident, they're going to miss something. They're going to mess up. We should be having a race to the top of collaboration. Like, we need to be lifting up the intern, the nursing student, the resident, the new grad nurse. Like, we need to be going out of our way to make them as good as they can be, because then they'll make us better too in the long run, right? If I can't run a code by myself, I want everyone in that room to be excellent. They should be top notch. So, competing with each other, it's just a losing race. Everybody loses.
Did you get the same vibes from CRNA school too, as you did from like nursing school for the competition?
Way worse in CRNA school, like 1,000 times worse. You have all these really competitive ICU nurses. CRNA school getting in is extremely competitive. And there was a lot in the beginning of people kind of like showing off like what their backgrounds were and bragging about their clinical experiences. And it was really funny. I always tell this story. I'm not of that mindset at all, right? I've never been that way. I've never been a competitive person. I never even played sports. I'm just like, everyone, let's get along. So when I was there, one of our first exams was a silly exam. It was about the history of nurse anesthesia. And it's just abstract information that's hard to remember because it's names and dates. And like, it was really just to get us familiar with the course. And it was like one of our first exams of school. And so I made a study guide of like really funny ways to remember all the names. And I shared it with the class. People were blown away. Oh my God, why would you share this with us? Why would you want us to do well on the exam also? Why can't we all get an A? Like, we should all be getting A's. Like, that's right. A great thing, right? Mm-hmm. So it's a really silly story, but it just was so funny how it just shocked people. And then the really competitive people, started competing to share their study guides too from then on, because they wanted to look as helpful. Like they were like jealous that they weren't the helpful ones.
I think that was the worst thing when you just finish your test in nursing school and you're just like, oh, what'd you get? You know, and everybody's just kind of like, they got the better score, but they're very like, you know, kind of low key about it. And then you kind of tell them the score like, oh, I got a, 93. Like, oh, no shit, nice to know, man, kind of putting me down already. It's kind of funny how that competition carries over. Geez, I had a question and it was so good and I just blanked out on what it was because I had to tell this story because it upset me so much, and you mentioned it, that happens on the test well, CRNA. Do you see, you said you saw that competition as well in nursing, right? How can we kind of like get away from that from like a psychological standpoint? Is it like a trauma that maybe we had as growing up, or did school teach us like this mentality of competition? Because you have a lot of competition, right? You like love it. Like we just kind of like, it kind of like boosts us in a way. Like we take competition and we have a positive out of it, but clearly it's a negative, it has like negative reputations as well.
Yeah, there's definitely such a thing as healthy competition, right? Like if you, like, let's say, sports are a great example of a healthy competition as long as you have a good attitude about it. But I think it really is part of our education system, this unhealthy competition where we see our classmates and our coworkers again as like a threat to us, a threat to our us looking good, our survival, our well-being. And I really think it's starting in as early as the high schools these days. Kids are in high school. I feel like that's a time when you should just be like enjoying your life. Like, yeah, study and get good grades, but how many extracurriculars, sports, clubs, volunteering activities do these people have to be in to get into college in the first place, to pay a really exorbitant tuition, maybe that you shouldn't be paying, right? Like, why do you need to go to that nursing school that costs $50,000 a year when you have an ADN program up the street that's entirely valid? Why are we kind of competing to do things that aren't necessarily good for us? And then I think we definitely see people being pit against each other in the admissions process. I remember the person who was admitting me into my second degree nursing program, and she was interviewing me. She was really nasty. And she was telling me about how, oh, well, we don't normally really like students who come from a university like yours. I went to a small Christian college for my first degree. She's like, ooh, yeah, Eastern University. That's not a school that we really look at very often. I was kind of shocked to hear that in an interview, just so blatantly outright, right? It was a pretty nasty thing to say when my education was perfectly valid. In fact, I learned a lot. So I think it really starts like as early on as, the high schools and the colleges. Like, why are we starting that culture so soon and encouraging it? I really think that it's the job of educators to kind of encourage ways to stamp that out, especially if you're like a nursing instructor in a clinical and you see that behavior, you really need to lead by example and encourage the students. I think by educators being discouraging, they're just perpetuating that culture.
Yeah, and also comes to like leaders. I said it also comes down to like leaders, like management, correct? Like that example about drama, correct? If you don't have a leader that says, hey, maybe, this nurse, they should talk it out. They should tell each other the problem and see what happens, instead of like escalating right away to the manager, where instead of telling you, Chrissy, I go tell the manager tells you. Now you feel like you kind of like, backstab me in a little way. And that already develops a culture of negativity and kind of like being very quiet about things and what people talk about themselves. And that really upsets me. Yeah.
Here, like in the United States, like, because you mentioned schools and stuff like that. Here in the United States, like your senior year of high school, you're prepping to go to college. And a lot of people want to go to these giant universities for like a nursing degree, like you said, that you can get kind of, maybe a few blocks down with the same amount of education, but the cost is maybe like a quarter. So there's just always like this push to go to these prime universities, these nationally known universities for like these, I don't want to say basic, but these like general degrees that you could kind of get anywhere. And I feel like that leads a lot of people to being in debt.
Yeah.
So not only are you like putting yourself like behind financially, you also don't need to kind of go to that school. Some people just want to go to that school just for that recognition. Like, hey, I went to Northern University, I went to this university. And in the long run, I don't care where I went to school. Like the nurses on our unit, I don't know where any of them went to school. It really does not matter in nursing where you went to school, where you got your bachelor's from, because nobody really cares about it. And people think they have to go to these high acclaimed universities for their bachelor's in nursing, which is totally false. And they drown themselves in debt, paying over 100K for a nursing degree, where in some states they're gonna make 60K, and their take home is gonna be like 50, and it's gonna take them years and years to pay off those loans. And it's just I don't know why it's such a big like stigma associated to go to these giant universities.
I would say it's a push towards, like, I don't know, when you're younger and, high schools teach you, oh, you have to go to this school, you have to get into this school competition, just like we just mentioned, it forces you to get on that mentality, And it always kind of puts you in that like kind of hustler mentality, always trying to like, outperform people.
Right. And nursing should never be competitive. It's just like, it should be a completely collaborative effort. Like, we should all focus on getting our patient healthy, and not I got my patient healthier than you did. Like, that doesn't make any sense on that kind of a level. I just don't get this competition a little bit sometimes.
Chrissy, if you were your younger self, what would you tell your younger self when it comes to maybe building the habits that you have now and you didn't know about them when you were a younger nurse?
Habits. I think I would have told myself to set boundaries earlier. Learning to set healthy boundaries with the way people speak to you, even as early as nursing school, right? Like, just because you're a student doesn't mean you need to accept abusive language. Boundaries with work, right? They're short nurses, but you can't always be the one to save them. I think setting healthy boundaries at an early age, I think that's really hard to do as a young person, especially people who go into a field like nursing, right? We tend to be really, really empathetic people. We tend to feel everyone else's emotions and take on other people's burdens. So setting down healthy boundaries so that you maintain, your own wellness, I think is key. We all talk about self-care, but really that's kind of like a treatment on the back end after you've already been burned out, right? It's not really a super effective way to prevent burnout. I think it's kind of a cop out a lot of the times when corporations do like, we're going to start providing you cookies and massage chairs. That's great. Love the cookies, love the massage chairs, but I need to be protected in the first place. So I think boundaries is like the number one thing.
And I feel like it's so much harder because we learned that later on in life. And now as nurses, you get put into this pandemic. And nurses are already burnt out. We're already stressful. All these things that we mentioned are already there in the workplace. Now put a new grad in there, and they don't know how to set boundaries. They internalize things. We know nurses that have to step away from bedside and hospital care because they feel like they don't have enough resources. They don't feel appreciated, right? Like, remember that one story that we heard that like the charge nurse didn't care about anything. Alarms are going off. Mm-hmm. And it just freaks out somebody, especially being so young and being so new in healthcare. And they're like, oh my God, my license is on the line. That this person is dying. It's my fault. What can I do differently? Like, that really plays with your psyche.
Exactly. Like, setting boundaries is very crucial. There's a nurse that we work with that it got to the point where the manager was thinking about, so you know how as an ICU nurse, you want to have that longevity of patient care. So you want to have the same patient, like if you're doing 3 in a row, you want to have the same patient 3 times in a row, for better patient care, because you have the continuity of care. It got to the point where these nurses were getting so attached to these patients, where the manager was thinking about not giving the same assignments to the same nurses 2 or 3 days in a row, because they were so emotionally invested in these patients. Like, that's how bad it could get. That's how bad it got on our unit at one point. And just setting boundaries is just so important to our lives, because if you keep taking home the things you do at work, you're never going to be happy in your life. You're always going to be depressed, because as ICU nurses, we deal with, unfortunately, the dying and the very sick people. And a lot of our shifts aren't very joyful.
Yeah. It's been rough. So you say that to set boundaries, correct? So me being a new grad, how do I exactly do that? Or somebody that's listening, how do I set these healthy boundaries for myself?
That's so hard. I mean, I think it depends on what we're talking about, right? So when it comes to how other people speak to you, let's say there's a coworker who just really is talking nasty to you that day, or whatever it may be. I think the best thing you can do is like practice at home, modeling how to speak up to people in those situations. It sounds really silly, but having kind of like a script ahead of time can help you in the moment stay calm and just, be able to respond appropriately. So, for example, if someone is telling me, oh, I'm so dumb. How did I not know this? Or telling me like, don't do this in the future, whatever it may be. Let's say I made a mistake, a simple mistake. Recognizing what that person is saying. I understand, that I did whatever wrong. I programmed the pump wrong, right? I recognize that you're trying to teach me a crucial point for patient safety. In the future, I will not repeat that. I'm going to read up on it tonight, right? That little like sandwich. I understand what you're saying. I recognize the intent behind what you're doing, and here's my plan for the future. And I think that typically diffuses issues. If someone continues to abuse you further, it's okay to set the boundary down and just say, you know what? I'm really not going to tolerate being spoken like that. We can talk later. And that's it. You don't have to say anything else. I will not tolerate being spoken to like that. That's a really healthy thing you can do.
That's a very good one.
Yeah. And same thing with like being called in all the time, right? If you can't go in, just say no. You don't have to give an explanation. Sorry, I can't today. That's it. You don't have to give an excuse.
I feel like it's also harder with speaking up for yourself with this whole cancel culture that we see right now in America.
Oh, yeah.
Like if you say something that doesn't go along with, the mainstream media, you get basically looked at, correct? Yeah, and you get almost like medical bullying, correct? One of the examples were the whole vaccine issue, correct? Like maybe there was some nurses that didn't want to take one and they rather wait. We know people that just felt bullied into just taking it just because they had to, because everybody else did. And that should be never a decision to take a vaccine. It should be just based on your own health, not an obligation because you feel the pressure from society or from a group of friends or coworkers in this case.
Right.
That's really hard. Yeah, that's one of those strange ethical dilemmas, right? Because as healthcare workers, we just so want to like protect each other, protect our patients, set an example, quote unquote. But at the end of the day, everyone still has bodily autonomy, right? Like, what if someone was pressuring you into taking a pill? That would be crazy. So you're right. It's really tough. We have to just respect each other. Sometimes people won't agree with you, and we can't just cancel everyone or bully them into believing what we believe. It's absolutely unhealthy.
Agreed, 100%. What do you like doing in your free time outside of nursing, and how do you de-stress?
Oh man, this year really took away a lot of my fun things, which was a bummer. I used to love going salsa dancing. Obviously, that's like not an option right now. I started getting into TikTok. It's like an outlet. So creating on social media was a lot of fun for me, and I found a really great community where I got to know a lot of amazing people and found ways to connect with people virtually. But at the same time, that kind of turned into a job too, right? So now I'm trying to get back into like some of my other hobbies that don't require in-person socialization. I love to cook. I cook plant-based recipes, I like to create new recipes. I like to experiment in the kitchen. So that's like my one safe, only for me hobby.
So if you cook a lot of plant-based things and desserts, are you vegan or anything like that? Or do you follow like some kind of a diet?
I like to say I'm on the vegan spectrum, because veganism is so much more than just a diet, right? It's a whole lifestyle. So it means you never have any like animal products at all, as much as is humanly possible, right? Because there's always some degree of animal involvement in certain things. And I try to do that as best I can, but I'm going to be honest, I'm not perfect. Like when I go on vacation or if I'm at someone's house and there's nothing really to eat except for something with dairy, or even occasionally like fish, like shellfish, for example, I'll definitely cheat and eat it. But not at home. At home, we're definitely vegan. So I can't call myself vegan. So I say plant-based because it's more, it encompasses it a little bit more accurate.
Yeah. When did you start being plant-based and why with the switch? Because Matt and I, we've tried being vegan. This was like 4 years ago.
Yeah, like 2016.
Then 2016, before there was a lot of vegan options out there. Like now you go to any kind of store and you can go ahead and get anything plant-based. Back when we tried being vegan, there was nothing plant-based. The majority of our diet consisted of Oreos, and we gained a bunch of weight.
Yeah.
But why did you switch over to being more plant-based?
It's funny. My parents actually started it. They watched that documentary Forks Over Knives, and I had already seen Food Inc. And my parents got into being plant-based for a little bit. They quit pretty early on, but I was like, if my dad can do it, the man who lives off of meatballs and cheese and, like, I was like, if my dad can do it, I can do it. And I love to cook. So I thought it was fun. So, instead of jumping all in, I was like, that's going to be too hard for me. I'm just going to start cooking like one meal a week. Philadelphia is a great city for vegan food. Lots of vegan options at like almost every restaurant. So it was like when I'm out, I'll get the vegan option. So starting with just like 1 or 2 vegan meals a week. And then the better I got at making recipes, I was like, okay, now I found food I like. I just kind of kept going from there. And one day I tried meat. At my wedding, I had the meat that was served at my wedding. I hadn't had meat in like a year and I hated it. I was like, oh, this tastes weird now. Like it didn't taste the same to me. My taste buds had changed. So I was like, okay, I guess I'm there. I guess I've arrived.
It's awesome that your parents or your dad, in this case, motivate you to do that. Because for us, it's the exact opposite. We come from a Polish culture. And, like on Sundays when you have like dinner, you get left out. Like, you can't have this chicken or this meat dishes that they make. And you're just kind of like hanging out on your own and, picking your vegetables and potatoes or whatever.
Yeah,
now they're back to eating meat. So I don't know. But
yeah, we're back to eating meat too. Like I tried actually the carnivore diet like last month for like a week. And it was tough. And Matt and I, we mostly keto based. So our diet does consist largely of meat. Vegetable. For him, vegetables. I do like a carnivore / keto hybrid kind of thing.
Oh man, I think I'd have a hard time with carnivore. That one's tough.
Really? Yeah, it was pretty tough. Low key, like it was fine, but like I had like the worst GI symptoms ever. Like I had diarrhea all the fucking time. It was horrible. I had to stop. I was like, I can't do this. I can't live like this.
Your gut microbe is reprogramming, man.
Yeah.
How is it being a CRNA nowadays with pandemic and then slowly things opening back up, correct? So I'm sure you guys had like a little slow moment in surgeries.
Yeah, it was kind of crazy. So, Philly didn't get hit quite as hard as New York, but we had a surge that trailed them by about like 2 weeks, I'd say. And fortunately, because we had that like 2 to 3 week gap of like lag and our numbers going up, I think our city was able to get kind of on top of capping it off a little bit quicker. So it was nuts. When you're in anesthesia, you're right up in the patient's airway. So everything we do aerosolizes, viruses. And so, you're intubating COVID patients, right? You're putting breathing tubes in them and you're creating a plume of aerosols that studies show can last in the air for 3 hours. That's pretty scary stuff. And the data that was coming out of Italy and China was saying like all these anesthesiologists and dentists and ENT surgeons, they were all dying because they were in patients' airways before they understood what the virus was. So that was kind of scary. And then, of course, we had like the PPE crisis, right? So thankfully, my job, we had a pile of N95s, but we were reprocessing them and reusing them for a while. We just went back to normal stock this week, which was awesome. We did have to cut down elective surgeries at one point. So we were all taking turns being on airway call, where we would go and put breathing tubes in patients around the hospital, lots of COVID patients. Regular call where we do emergency surgeries and traumas. A lot of our trauma patients came in with COVID. We had to treat everyone as though they had it until we found out otherwise. And I would say, I don't know what the percentage was, maybe at 25% or half of the traumas would end up being COVID positive. And then they redeployed us to the ICUs. So we're helping the respiratory therapists because they were stretched thin, right? Everybody was on a ventilator, not enough respiratory therapists. So they cross-trained us to be respiratory therapists. So we were managing the vents. So again, a lot of time in COVID rooms, people's airways. So it was kind of crazy. But, I was really amazed by the ICU nurses who were handling it. I felt like everyone in the hospital was working so hard, but they were spending the most time like one-on-one in these rooms and doing like the really hard back-breaking labor and just not complaining. It was amazing.
Yeah, it's tough for nurses. Like looking at my last shift yesterday and how like 60 people are, and it's tough work because you got to prone these people sometimes.
Proning,
yeah.
It's so hard.
And then you got to put them in this position every couple hours. You got to rotate the head, and actually. Last night, or 2 days ago, when I was at work, I had a prone patient, and I was, repositioning them, and I actually turned their head, and I dislodged the ET tube, so they ended up desetting to the 50s. And then everybody had to come. Intensivist ran in here, we had to supine her, then we bronched her. The respiratory therapist came and we had to adjust the tube, and then I had to supine her again, and that was literally a back-breaking labor. The lady weighed. Our person weighed 108 kilos, so she's heavy. There was like 4 or 5 of us in the room trying to prone her, and it's just like a mess, and it just adds so much stress. And then for that 2 to 3 hour period of us trying to stabilize that patient, my other patient got completely neglected. It's like almost like that patient didn't exist. Like they were stable, they're kind of ready for transfer for the most part, but still that 3 hours was just devoted to one patient, and whatever my other patient needed for that, like the time, it's just the needs have not been met. It just shows you how stressful and how tough the ICU can be.
So scary.
Yeah, you know that feeling in nursing where every single shift you go into work just not knowing what to expect? I used to be okay with that feeling. That's just like, oh, okay, it's just part of nursing, I'll get what I have this night and I'll make it through. But now it almost seems like it's unbearable. Like it's just like, damn, I'm probably gonna have a bad shift. Like you're almost like predicting what's going to happen because it's just bad, man. Just lack of resources, and these intensivists are kind of struggling too. They don't have time to do proper care, or maybe they're missing orders, or they miss some labs and you miss it too, and then you're kind of like chasing things back, like like a high K or something, or just like having a Bumax strip that's running too long, and then you're freaking chasing 120 a K, and then your patient goes into a junctional rhythm next shift because they just loaded him on K, right? Like that one situation.
Yeah. Oh yeah, that was an intense situation. Especially as like a new grad, when you're a new grad and you finish orientation, you're like, yeah, finally nursing by myself. And like Matt said before, it takes like 3 years for you to get comfortable. But within that 3 years, if you have that like a bad shift and you're a night shift, like your thoughts linger around work. There's been so many times where I've had a bad shift at work, and then the next day, or like I had a bad shift at work, I'm off for a few days, and then the day that I go back to work at 7 p.m., I'm thinking about that shift all day. Like it's on my mind. It's like, what's going to happen this time? What's going to go wrong? And you're stressed for literally that whole day before you even enter to work. And I'm sure you've had those feelings as well. How did you kind of deal with those feelings? Those feelings of I'm not sure what to expect at work and it's stressing me out.
Yeah, I would just label it as dread. I used to dread going in. I'd be nauseous on my way in the mornings. Oh, I remember that feeling. It was so tough. It did get better with time. How did I deal with it? I feel like, you know what? I really wish that I dealt with it differently. I feel like I did a lot of I'd go home and I would talk about it and talk about it and talk about it and just like try to process. And I feel like it wasn't effective. I wish I had just gone to a therapist, honestly. I feel like had I just found a better way to process it and cope with it, I could have made my suffering so much better. Shorten the duration of that time period that I suffered and eased my own suffering. I think once I learned and truly stopped internalizing, right? You can only control so much. Like these people are very sick and what's happening in their bodies is not your fault. And all we can do is assess them, monitor them, and give the appropriate interventions, right? So you're looking for changes, you're trying to catch things early. And when something bad pops up, it doesn't mean you missed it. Sometimes that person's just very sick. And, if they weren't in your care, they would have been dead a long time ago. So that is something that like, once it clicked with me, like without everything I've done, they would have already been dead. With everything I've done, they're already better off. All you can do is what's in your control and in your power. So I think once I truly believed that and it clicked, it really cut down on the dread. But I wish I learned it sooner.
Mm-hmm. Yeah, I think like that's what's so amazing about social media and like, people like us and you and everybody, like we're slowly forming these communities of nurses and we're like learning to be more conscious and taking care of ourselves and stuff like that because, we didn't sign up for this. Did you know this is the feelings of nursing school, like no one told us about this. Like I didn't sign up for this. I really didn't. I didn't expect nursing to be the way it is. And I'm getting through it. It's great. I enjoy everything I do. I have great, what do I have?
I don't know what do you have, Matthew.
I'm trying to like think of the word, I love nursing for what it is, but is it my be all end all? No.
Yeah. Is nursing what we thought it was going to be? Absolutely not. Absolutely not. Like me picturing a nurse when I first started nursing school is not what I currently do right now. Maybe like 20% of it is. So how has like your viewpoint of nursing or thoughts on nursing changed compared to what they are now compared to how they were when you first started school?
Oh my gosh. I feel like I didn't truly understand the role of a nurse, honestly. I mean, the nurses I had been, there's no examples of nurses on television. Like you can't convince me that any show on TV accurately represents nursing at all whatsoever, right? I feel like there was background characters or just like the nice nurse, right? When I was in school, I think it took me that whole program to really figure out like, what the hell is my job, right? what is my goal here? I think nurses are the eyes, ears, hands, and feet. I think it's shocking. It's shocking to me how much nurses do. You really are the person who is seeing everything, listening to the patient, communicating with every member of the team, right? So not just doctors. Everyone thinks it's like, oh, nurses and doctors. Social work, the chaplain, respiratory therapy, physical therapy, the family. You are literally like the spoke of the wheel, the hub of the wheel, right? And you have to connect with all the other spokes. And it just shocked me, I think. I don't know. I really had no clue.
I really like that analogy, right? The hub. And that's like the worst part of all this is that, you know, like 2020 was like the year of the nurse in a way, and we've seen everything the way we're struggling. And if you look at it, like how has things changed for us as nurses from like a standpoint of the way healthcare administrations handled us or government, like nothing was really changed much. We're still doing more with less. And we just got fed some food. We got a nice pin, frontline, workers, and that's really it. And that's what bothers me is that we need like real change being implemented in nursing because we're suffering,
Yeah, there's times that I think with this whole pandemic this is just a whole giant conspiracy on how far we can push nurses to see how much they could do with the least amount of support. So I feel like sometimes, and it shouldn't how this should be, how nurses should be, and I shouldn't be having this outlook, Look, if you could offer advice to nurses out there or CRNAs, like what's one piece of advice you'd give them? If someone's going through CRNA school or struggling as a nurse, what can you offer to them?
I'd say reach out for help. And I mean, and not only, with people who are your colleagues, your classmates, like, yes, you should form a community of trusted people, but looking for mentors who are further along in the field than you. Don't be afraid to ask like an older nurse to be your mentor, or a professor, or, someone on the internet. And then of course, back to the boundaries and, going back to what you mentioned about stretching nurses thin. And I really think that another huge form of boundaries that we need to advocate for is the Safe Nurse to Patient Ratio Act. Really, we need to really, really, really rail for that nationally. I think that's the only solution for protecting each other.
100%. That's something we've been talking about for a very long time. We're just like, how can we do this? How can we implement it?
So there's a bill. If you go to nationalnursesunited.org, they have a proposed bill in the Senate and the House. They try for this every year, and you can write letters to your Congress people and your senators. And they have like a pre-written form for you already. You just have to fill it out. So nationalnursesunited.org, and you can try to get support for that. Now, I know you're already in California. I know you guys are already, you already have those ratios, and you already have a nursing union, and you still are experiencing trouble with COVID, which is awful. But don't let them, keep you out of ratio when this is all over. Like nurses really, if you're in a hospital that's really abusing you, it's okay. Unionizing is within your legal right. And people really forget that. And they're afraid to talk about it. It's a really taboo subject. People are afraid of losing their jobs if they talk about unionizing. So fighting for national nurse to patient ratios, and, maybe it's time to look into really coming together and protecting each other.
And that's why I mentioned that, we're developing and building those communities because eventually we'll have that power to come together. And it's not necessarily striking that we're going to walk out of the hospitals, but it's just us coming together as a community and, letting government know that, hey, it's about time we have some real change implemented, right? Because anywhere else, like, 9/11 happened, things were implemented, different things, different chain of events that happened. There was implementation by the government that helped out. Pandemic happened, and nurses are kind of dealing with the same issues. Yeah. Just like I mentioned before, more with less.
Yeah, and there hasn't been any talks of improvement or anything like that. It's just like, all right, we're in a pandemic, we're in a crisis, so you're expected to do all this extra work. And thank you for doing all this extra work. Here's some food. Yeah. But there's really nothing being spoken about what's going to happen long-term wise after the pandemic rolls out, right? No one's really talking about that. And unfortunately, no one's talking about it because it's going to cost them more money, and nobody wants to address that issue. It's going to cost them more money.
Exactly. Just like in Illinois, they try to pass the ratio, and I think the American Hospital Association, because there's obviously money being lobbied, right? they basically said we can't afford this bill because the hospitals can't afford more
Not
nurses.
true, though. It's so not true.
Yeah, no, right.
That's the biggest lie that they say. And then they play on nurses' empathy, right? Because nurses say, oh, gosh, I'm going to bankrupt my hospital. My community won't get care. Oh, I'll just suck it up a little longer. It's so not true. It's absolutely not true. Every other developed nation in the world has appropriate ratios. California has appropriate ratios. None of them have gone bankrupt. They are doing just fine. So, don't let them gaslight you, man. Don't get me started.
Yeah. So Chrissy, where can people find you at? You're very popular on TikTok. I've been told you have an amazing Instagram. Where can people find you at?
So yes, I'm on TikTok. It's Chrissy CRNA, CHRISSY CRNA. My Instagram handle is also Chrissy CRNA. And yeah, those are like my two main platforms right now. You might find me popping in and out of Clubhouse occasionally if you're on Clubhouse yet, but that's it. Those are the two primary for now.
Damn, she's on Clubhouse. We got to hop on it. We've been talking about
Clubhouse. Oh, we could have a lot of good conversations on Clubhouse.
Is how that works? I'm completely delusional about what's going on in Clubhouse. I was supposed to do my research like this weekend, and finally we're supposed to make an account and start promoting on there.
You don't need to even research it. Just sign up. It's so interesting. It's like just live conversation, live podcasting, essentially, right? So you can create your own rooms and invite people to come in, and you moderate and you have conversations with people in the audience, with each other. Or you can just join rooms, you just pop in and out and learn from different people. So sometimes I join rooms for things I know nothing about, business, entrepreneurship. I don't know anything about that. And sometimes I'm in healthcare rooms. There's a really interesting COVID room going on right now where I'm always learning new things about patient care. And it's really great. So definitely look into it, Clubhouse.
Yeah. Like popping in and out of rooms, is it like chat roulette or Omegle kind of stuff?
No, man, it's like AOL, bro.
You know?
Describe it. That's actually kind of funny. Imagine if it was like nursing Omegle.
Yeah.
So they call it like your hallway, and then there's rooms in the hallway. So when you open up the platform, it'll ask you what you're interested in, and you'll see conversations suggested to you as you scroll down. So you'll see, oh, this is a room, and there's no video, there's no images. You just have your profile picture, and it's audio only. There's no DMing feature right now. So there's moderators at the top who've opened the room together. So it's like right now you guys are essentially moderators, and I would be a speaker, and then the people listening are the audience. And the moderators can invite audience members to come up. Audience members can raise their hands and ask to come up to the stage and speak and ask questions, and you can answer them. And, you could always move them back to the audience if there's, a lot of people that want to go and talk to each other. So it's cool. It's a live conversation with people from around the world. It's pretty neat.
That's interesting.
I think you sold us on it.
Yeah, it's right up your lane.
Thank you so much for your time, Chris. Hope you have a great day. Chat soon. Thank you, everybody. Thank you, everybody that's listening, guys, on Twitch. Thank you so much. See you guys next Friday.
Have a great day. Bye-bye.
Bye.